Hello and welcome to Summit. It's another interesting edition of the program. And today again we'll be focusing on Lagos State, highlighting another very lucrative and wonderful agency in the Lagos State government. Today we are at the Lagos State Health Management Agency, and I'll be chatting today with the permanent secretary of that agency, Lagos State Health Management Agency, Dr. Zamba Olutoyin Emanuela. Hello, ma. Good to be with you this afternoon.
Thank you very much.
And I must say your office the wall is filled with award flags. And that's a good one for you.
Thank you very much.
Congratulations on the good work you are doing. That's just what it means, that you're doing a good job.
We only can try.
Well done. All right, so go start with wanting to know more about this agency. When was LASHMA established, and what are the core objectives for its establishment?
Okay, so thank you once again for having us on. The Lagos State Health Scheme Law was established in 2015, and that law established three things essentially. The first one was the Lagos State Health Scheme itself, which is the state's health insurance scheme. It also established what we call the Lagos State Health Fund, which is where all the premiums for health insurance are put in and ring-fenced, so that we are able to provide care to Lagosians. And finally, of course, it was the Lagos State Health Management Agency, which is supposed to drive this particular endeavor of Lagos State. The agency was set up essentially to provide accessible and quality health care that is affordable for Lagos State health residents through the vehicle of health insurance. It is also supposed to ensure that there is equity, and what that means is that even those that cannot afford it should be able to have access to the same health care as those that can pay. So that is one of the core elements of what we are supposed to do here. We're also to help to strategically purchase these healthcare services so that we drive down the cost of care and make it, relatively affordable across board. But those are the tenets of what we are about here in LASHMA.
All right, so I like the fact that you used the word affordable like 3 times while you were speaking. But to what extent does it resonate with the Themes Plus agenda of the administration of Governor Babajide Sanwo-Olu?
So I think as an agency, we speak to the H in Themes, and we also speak to the plus in Themes Plus. Under the second pillar of Governor Babajide Sanwo-Olu's agenda, health is a major pillar. Health and environment sits in the second pillar. And for us in LASHMA, what we are supposed to do is to ensure that Lagos residents have access to quality and affordable health care. On the plus side is the issue about social inclusion, which is to say that those of us that are vulnerable within Lagos State, they should not be excluded. They should be able to have access to the same kind of care. And that's something that we do using the ECOSHA arm of LASHMA in the agency.
Okay. All right, so everyone knows about Ilera Eko. It's a popular name, it's a popular program everyone knows for the Lagos State government. However, would like to know some of the frequently asked questions by Lagosians under this scheme.
Okay, so expectedly one of it would be, how do I register? How do I become a member of the Ilera Eko program? Another one is, where can I register? That is also a question. Also, we get things like, if I have a complaint, how do I register my complaint? Is the facilities that we have access to, is it just public hospitals or public and private hospitals? That's also a very popular question. And then also, there's also the question about, if I have more than the family of 6, which Ilera Eko is marketing, how do I get that additional member of family on board? The other questions are around maybe drugs and what tests, asking questions about the benefit package and the specific services that they have access to.
All right, so I guess in the course of the conversation, you'll be able to give answers to these frequently asked questions.
That's fine.
All right, so but what are other flagship programs LASHMA has successfully initiated and executed? Are there any other ones?
Okay, so I'll start with talking about the Eco-Social Health Alliance, which we call ECOSHA for short. And that is the arm of LASHMA that is responsible for ensuring that we cover as many vulnerable people in Lagos State as possible. Lagos State is the first to set up that sort of arm within its own social health insurance agency. And what they do is, apart from the equity fund which Mr. Governor has given to us, which is 1% of the Consolidated Revenue Fund, which coincidentally he just gave the approval for that to become a first-line charge in Lagos State, which means that we get that money very frequently and regularly, and we are able to plan and target even more vulnerable people. So that's one of the initiatives that we have in this agency. And thus far, we've been able to cover about 450,000 plus vulnerables, and we continue to do that every day.
But how do you, okay,
go ahead.
Go on, you land.
Okay, I want to talk about another initiative.
Yeah,
but if you have a
please
question
go on.
to ask about that.
I'll bring it up later.
Okay, excellent. All right, so another initiative that we just put to bed, let me call it that, in July was that we launched what we call our standard JARA plan. And in that plan, there are two things that stand out. The first thing is that we now have telemedicine as an integral part of the plan that you buy here. So apart from you being able to walk into a health facility, you are able to either call the hotline, you can download the app and you can speak to a doctor from the comfort of your home, or you can walk into what we call our virtual booths, which are spread across markets. Right now, we are rolling that out. We intend to get that to up to 300, but we have started with 5 in 5 major markets across Lagos State, and we'll continue to do that. That is a major innovation, which will ensure that it's not all the time that you have to run to the hospital. If you have something that's a minor ailment or you have a question, you can easily just use the telemedicine to be able to access care. We have also included things like dialysis and cancer care, which is not very common when you have social health insurance plans. So that is one of the innovations. The other one I would talk about is to do with the fact that we have instituted like what we call like an instrumental payment mechanism. We call it Ilera Eco Pay Small. So for the informal sector, who is our major target, they are the ones that are largely uncovered in Lagos. For them, even what we call affordable might not be affordable for them to bring it out at once. And we know they earn a daily stipend. That's how they earn their money. So what we say is that you can pay monthly, you can pay quarterly, you can pay half yearly according to your pocket, so long that you are able to cover your family. And once you are paying instrumentally, you will still have access to the same type of services that someone that paid upfront has. That's one of the innovations that we also have.
They are very interesting innovations.
Thank you.
But let's go back to the issue of some of these frequently asked questions,
Okay.
especially on the issue of registering for the health insurance scheme. What special advantage does it confer of those who have keyed into the scheme? That's starting from registering to what you have to benefit along the line.
So because we are social, we are very focused on the informal sector. Hitherto what was obtainable in Lagos was the private health plan, which is usually geared towards corporate Lagos and people within the formal private sector. But we know that the informal sector, there's a gap, and we also brought on board the public formal sector, which is the public servants. So when you register with us, one of the benefits is the fact that because we have been able to pool resources together, we started with the public servants, we are working with the informal sector, we have the advantage of having a huger risk pool than anybody else in terms of those that are playing in the health insurance space. And that allows us to be able to subsidize the care that is being given. So if you compare the kind of plans that we have, the plan that we have under Ilera Eco, and compare it to another one side by side, you will see that the benefits that you are getting for a lower price is way much more to your advantage than taking a higher price plan that has lesser benefits. So that's what the social is about. And one of the things about social insurance is as you grow more people in, you will be increasing those benefits. Where we are now with benefits is not where we started in 2020. We've been able to add other things simply because the scheme has been growing.
Who are those who are eligible for this scheme?
As long as you live in Lagos, you breathe air in Lagos, you work in Lagos,
you drink Lagos water.
You drink Lagos water, you are a resident in Lagos, you are entitled. We don't have any exclusions, and we don't look at your age, we don't look at where you come from, we don't want to know if you have a pre-existing condition. It is for everybody, it is inclusive.
All right. So I heard you mention something about the number of family members that can register under the scheme.
Yes.
Could you elaborate a bit more on that?
Okay. So for an individual per year, you pay 15,000. If you're a family of 4, we've looked at the fact that, you know, in the economy now, people are having smaller families. So if you have a family of 4, which is father, mother, and 2 children under the age of 23, you pay 55,000 for a year. And if you are a family of 6, which is father, mother, and 4 children under the age of 23, you pay 80,000 a year. If you have an additional family member that you have to add on, you pay an additional sum of 10,500, assuming that person is under the age of 23, but not yet. But if it is an adult, then you will pay the adult price, which is 15,000. Correct.
All right, thank you so much. All right, so with the benefit of hindsight, to what extent has it made healthcare delivery and procurement seamless and accessible to Lagosians? Are people really keen into it? Are you satisfied with the level of people's involvement in the scheme?
Okay, so we are the major initiative in government for universal health coverage. Universal health coverage is a journey. You never really get there, you know, because you have to look at the number of people you cover, the services that you are covering, and how much you are covering it for. So it's like a, you know, you have to keep trying to up the ante as you go along. So I will not say that we are satisfied. We are happy though that where we started in 2020 is not where we find ourselves in 2024. Certainly, as you mentioned before, awareness is much more improved. One of the major challenges, however, is people's mindsets and how they view health insurance. So it's not a thing that is embedded in our culture here. People can't really understand the concept of paying for a sickness that may or may not come. And so you find people, and you know, we're very spiritual people.
It's not my
God
portion.
forbid, it's not my portion, and things like that. You know, they're not able to understand that it is to your advantage that you pay a little, small, somewhere, pull it so that the day you need it, you will be able to access it. Even if you have 0 naira in your pocket on that day, you will get the care that you have been promised. So it's a way of planning your life, you know, and having quality of life for your family.
All right, so what has been your experience about people being able to afford, even the fact that you said they can pay small, or is it along the line when you saw that people were still struggling with payment that this pay small was actually introduced into the program?
It's actually, we started with pay small because we wanted to penetrate the informal sector. And we realized that because of their peculiar way of earning, asking them to pay that out of pocket, not all of them that are in markets
because
or
if you think about it, 15,000
yeah.
or 50,000 doesn't sound
very big. But for someone that's earning maybe 2,000, 5,000 a day, that is something huge to ask them to fork out at once. So that was because we were entering the informal sector space. That's why we decided to have the pay small. Affordability is a relative thing. I can assure you that even if we said it was 5,000, some people would still make the case for the fact that it is still too high. Why can't you reduce it to 2,000? You know what I mean? Yeah. But as long as we provide the leeway that if you cannot afford it, and we genuinely see that you cannot afford it through our Equisha initiative, the government has funds set aside to be able to cover you and your family. We have people that support us in terms of sponsors. Every day we get, you know, non-governmental organizations or churches and even politicians, etc., coming to say, oh, I would like to cover the widows in my community. I would like to cover, you know, things like that. So it's like an alliance of not just government.
Is that a huge space?
It is a huge space.
A huge space.
It is a huge space. We know the level of poverty now. And there are a lot of people that are ready to give back. They just need to have some kind of structure around how they do it. And you need to be able to show them that there's transparency and accountability with the funds that you collected for them. That what you said you would use the funds for is what you're using it for. And they can actually see that, you know, in terms of the care that these vulnerable get access to.
Okay. Do you have a target regarding registration for the scheme year in and year out? And how do you intend to make it increasingly attractive to Lagosians?
So we do have a target. The target is actually monthly for the in-house sales team and our marketing agents. The target is monthly. We do have an overarching annual targets, but we measure their performance on a monthly basis. So every month they have to submit data. We look at, did you hit your targets and things like that. And we have incentives built into that to help them to continuously drive. Yes, we do have, we are able to ensure that we meet our targets to a large extent. One of the things that we have put in place, courtesy of our Mr. Governor, who has been so supportive to Ilera Eco, he just issued an executive order saying that health insurance, social health insurance, which is Ilera Eco, is now mandatory in Lagos State, which is to say that all residents, be you a worker, be you an employee, be you a vulnerable person, everybody should have cover under Ilera Eco. And that machinery, in terms of what will be put in place, is to help us to drive and increase the uptake under the scheme. We will start by, first of all, doing massive public awareness, one of the reasons why we're here, for instance, and do what we call like moral suasion. If people are not aware that something is now mandatory and something is to their benefits, you are not able to get them to buy in. So we'll spend some time trying to get people to understand, you know, this is the new dispensation in Lagos State, this is why it is so, and this is how it can bring advantage to you and your family. And then eventually, sometime next year, maybe early next year, we'll start looking at how we can put in place things that would help us to ensure there is some level of compliance from Lagos residents.
Okay, so what level of cohesion do you have with like traditional rulers, community leaders? Because from the scope of what you are describing, I think there's need for you to have a kind of parley with leaders at that level. What is it like, or what has it been like?
So as I said, we focus on the informal sector a lot. So all the gatekeepers within our community have been at one time or the other engaged by Ilera Eco, and we continue to do that. For instance, last month, I believe, was it September? Yes, we had a retreat for all the local government chairmen in Lagos State. We had them in one place for a 2-day retreat to educate them about Ilera Eco, give them the benefits and so on. We visit our traditional rulers. We have involved CDA and CDC structures. We are working with the primary health centers and their health educators, you know, religious leaders, and so on and so forth. We are all over the place. And in this place, there is no working day or non-working day. We go out because if you want to see people in the church, you have to go on Sunday. You want to see people in the mosque, you have to go on Friday. People have events on Saturdays. So it is Monday to Sunday in this place in terms of trying to get this message across to people. And we are very, very strong within the community. We even have open divisional offices. We have kiosks that are outlets. We have partnered with LASRA to ensure that if you walk into LASRA office to do your Lagos State registration, you are able to also register for. And we'll continue to do those kind of partnerships so that Ilera Eco is everywhere and it's just a few steps away from you to be able to, you know, come on board.
Come on board, all right. Please, I would like to take you back to the people who work for you, especially those who are on the field, talking about their competency and the level of training you actually give them to be able to represent the agency, you know, properly. How do you recruit them? How much training do they get before being sent out to be with the people?
So I will be frank and tell you that there is no antecedent for social health insurance in Lagos State. We are the ones pioneering it. However, because we've been at it for quite a while, we have developed a curriculum. We do have the modalities for which you can. We have basic requirements. It's not rocket science, you know, to be able to come on board. What is important is that you do have a flair for salesmanship or marketing. And then they will take you through the rudiments of what is required for social health insurance, how you can appeal to people's psyche, and so on and so forth. And we continuously have sales clinics here every month, where all our agents come together, you know, rub minds on what, you know, has been happening in the field, what are the new policies that we are bringing on board, and what are the new strategies that they can deploy. That is something that is a continuum here. We also have independent marketing agents. We have marketing agents in terms of marketing companies that also help us to market Ilera Eco. And we even have a unit within the sales and marketing team headed by an agents coordinator that handles those agents that are not within the agency. But it is a vibrant industry, and we have been able to do it in such a way that it is now a career for some people that want to venture into that space. So you come in as an enrollment agent. If you do well, you can rise to a sales officer, you rise to a senior sales officer, you can become a divisional coordinator, and so on and so forth. So there is progression, and it gives you that level of fulfillment to know that I am, in a career space, and I can be the best that I can be, because social health insurance is here to stay.
All right, that's so interesting and good to know. It sounds very organized, like an organized thing. Thank you. All right, so you said something about having numbers that people can call in case of emergency and all that. I'd like you to elaborate a bit more on that.
Okay.
And then if there are numbers that you'd like people to have, can also, let's have them.
Okay, so we do have a sales hotline, which is 0700 Iliraiko. We have a 24-hour call center with 2 toll-free lines that you can call any time of the day. We have people running shift here, so even if you call at 3 a.m. in the night, somebody will pick up your call and respond to you. And that is 0800 Iliraiko and 0800 Ask Lashma. We do have some WhatsApp numbers, which frankly I can't relative, but we'll be able to give you that at the end of the program, so you can help us scroll it. Yes, as you are.
Okay. Any challenges so far?
As I mentioned before, our people's mindset has been a challenge, and to change people's behavior and the way they think, it takes a while. So constantly bringing this message out there. So it's something that must be sustained over time, and then you will see people willingly coming in. We do have a lot of people that once you've been able to counsel them and show them some comparison, that look, if you go into a hospital that you have malaria, you will eventually pay anything from 10 to 20,000, and all we are asking you to pay for a whole year is 15,000. And malaria is one of the things that you will benefit from it. So from an economic sense, you will get some people coming to you that this thing resonates with. You will also have those that are on the other end or the other end of the spectrum with this spiritual mindset. But the truth of the matter is that at some point, everybody will fall sick. You just don't know when. You don't know what kind of sickness. You don't know how severe that sickness will be and how long it is going to visit you for. So why don't you just plan? That's something that we continue. Is a continuous thing, and I don't see us stopping for quite a while until, like the developed countries, this is now something that is a norm. Eventually, we will get there. So I would say that's the major challenge. The major challenge.
What about challenge?
Economy.
No funding.
Economy is the second one. But economy is also relative. Because some of the people that will tell you that they can't afford it, however, can do actually, right?
Yeah.
They're able to buy credit into their phones, and so on and so forth. They can go to the cinema or go and buy meat pie and things like that. So if you try to relate that to this funding that you are giving out and saying if you do it instrumentally, you will still be able to pay while still also being able to enjoy these other things. So it's, as I said, it is a continuous process in our communities.
So is it all about private hospitals or the state-owned hospitals that they can have these services?
It is both public and private.
Okay.
So we have some primary healthcare centers run by government on the scheme. We have secondary facilities, general hospitals, that, as we call them, on the scheme. We also have private hospitals. And right now, if you look at the balance, we have a lot more private hospitals because, generally speaking, in Lagos State, they offer about 60 to 70% of the healthcare within the Lagos State space. So yes, it is a combination of these two, public and private.
Okay, so if it encompasses the public and the private, is this still the same amount they pay?
It is the same amount.
The same amount.
That you pay.
Okay.
It is the same amount.
Thank you for clarifying that. Now, what would be your advice for Lagosians?
As I always say, the taste of the pudding is in the eating. Let's give it a try. You will never get health more affordable than what Governor Babajide Olusola Sanwo-Olu is offering under Iliraiko. It is something that will help you to plan your life and your family because you do not know who will be sick and when it will come. Just pay for this thing and ensure that, in fact, you can go to sleep to be assured that If anybody falls ill, you don't even have to have any money in your pocket. You'll be able to provide for them. You can now plan your family. Instead of paying 400,000, for instance, for your wife's cesarean section, you have paid the family plan of 55,000 for your family of 4. And it is covered. It is free. You don't have to pay an additional dime for that woman to deliver, even if it's under CS. But meanwhile, if you did not pay that 55,000, you will now be running around looking for people to borrow you money because you didn't plan for that CS, and you will now have to pay between 300 or 400,000 for something that 55,000 would have been embedded in it, and she will still get other care. Other members of your family will still have access to that care. So it's a no-brainer. You know, we are trying to make this as public knowledge as much as possible. That's just come and benefit from this thing. You'll be able to plan your family's life. You can plan for your children's schooling. You can even plan to maybe buy yourself a car. You can save and things like that. It helps you to have a better quality of life because health is unpredictable.
So I want to know about sustainability. What is the plan for sustainability for this agency?
As I said, this agency was established by an act of law, which means that as far as Lagos State is concerned, it is here to stay. We are now, let's not forget that there's even a national antecedent for health insurance, and that with the National Health Act that came out in 2022, it has recognized the roles of state social health insurance schemes, and that they are here to stay. There is an act of law. This is something that government is readily investing in. As I even mentioned, the equity fund is now a first-line charge in Lagos State. There is, and let's face it, Lagos State is one of those states that has, we continue. We don't really necessarily truncate plans that we have seen that are to the benefit of Lagos residents. It's a continuous trajectory of improvement for us in Lagos State. So it is here to stay.
Thank you so much.
Thank you.
Thank you for giving us your time and being able to come into your beautiful office.
Thank you.
To have this chat with you. I wish you all the best as you continue to do a good work in Lagos State.
Thank you very much.
All right, so I've been talking on this edition of Lagos in Focus with the Permanent Secretary, Lagos State Health Management Agency, Dr. Zamba Olutoyin Emanuela. We'll go on to our next segment on the program, still talking on Lagos State, showcasing some developmental strides in the administration of Governor Babajide Sanwo-Olu. So please stay with us, enjoy the package, and I'll see you again next time. I am Jumoke Michaels. Bye-bye.
Lagos, we just don't want to